You've heard about the internal bra, but you're actually not certain what it is. Well, this video is for you. The internal bra concept is pretty simple. Basically, we're putting a sling or a hammock underneath your actual breast tissue so that it holds it up towards your collarbone for a longer period of time. Typically, this is used with breast implant surgery. However, we can use it for actually just your own breast tissue. The thinking behind it is, of course, the larger or more heavier volume your implant is, the quicker it may slide down or sag. And if we have an internal bra to hold it up, that's not visible, but it's doing the hard work of holding it up inside the actual breast, then yes, it'll last longer. The visual concept is pretty simple. It is truly a sling or a hammock underneath the actual breast tissue. From a technical perspective, there are a couple ways to make an internal bra, and we'll go through those in just a second. They typically dissolve, whether it's made out of man-made material or sort of animal material. The thinking is that it's going to hold up for a certain period of time, and over time, a year, 18 months, a little longer sometimes, it will dissolve. The internal bras that are made from your own material typically do not dissolve. The materials include your own tissue. I can actually fashion a little sling from your own fascia, and then I can suture the bottom portion of the sling into your own breast tissue, and it's incorporated because of course it's your own tissue, but technically that does not dissolve. Interestingly, this is not that popular because what we found is that it's hard to get enough material from your own body's tissue and from the local areas around the bottom of your breast to really give you a good sling, a good internal bra. Another common material is Galaflex PH4B, poly 4 hydroxybutyrate. So this is a man-made material. It does dissolve over time. It's not derived from biology, from any animal or anything like that. You can actually cut it the way you want it, or me as the plastic surgeon can do that, as well as it comes in pre-formed sort of slings so that I can just suture it in. A different brand name is Durasorb. So that's PDO or PDO threads, which is the material of absorbable suture. This is another material that lasts a long time, but eventually dissolves over time. Finally, there's a newer one available in the US. It's called Avitex. It's made from sheep gut. And so this is a biologically based material. What it does is it actually creates a sling. And since it is biological material, it is a nice, soft, natural feel, but it still retains the ability to hold up the breast exactly where I want it when I put it in as a surgeon. There are other older materials which are less popular in aesthetic and even biological reconstructive surgery because they're not really rock solid. So what do I mean by that? You may have heard of ADM, acellular dermal matrix. So these are materials derived from animals, and it's pretty cool. I mean, it looks like dermis. It's a nice, soft, stretchy feel, and it typically comes in sheets. So I have to cut it in the operating room and create the sling. So if it's a larger sheet, I can usually cut it in half and put one on the right side, one on the left side. Now, the reason why we don't love them as much in aesthetic surgery is because even though we're creating a sling and it does a great job, we actually cannot, over a longer period of time, 6 months, 12 months, whatever, verify that it keeps the breast sling, the internal bra, in a specific spot. I can put it right where I want to as a plastic surgeon, but because of the nature of the material, it incorporates in your own body's tissue, but sometimes it can be a little higher or a little lower than where actually I put it at the time of your operation. The use of the newer man-made materials as well as Avitex sort of allow me as a plastic surgeon not only to make sure that it sits where I want to as a plastic surgeon in the operating room, but for you as the patient, it stays that way over a long period of time as these materials absorb. This is why acellular dermal matrix is a little less popular to a lot less popular in the use of aesthetic surgery, and specifically breast augmentation and lift, breast lift, or even just primary breast augmentation. Now, to be fully complete, there are a couple nerdy things that I can do on top of the man-made materials or the Avitex. Creating your internal bra, yes, putting in an internal sling helps a lot. I can actually still use your own body's tissue, use special suture, a combination of all three things to actually make sure that the bottom of your breast sling stays that way. It stays not only in a good position, but it keeps it that way over a longer period of time. Do you need an actual internal bra? I think that you don't really need it unless you want long-lasting results. So right after plastic surgery for breast rejuvenation, whether it's just a breast lift, breast augmentation and lift, a combination of just even breast augmentation only, if you want short-term results, just doing the procedure obviously is going to fight against the sag, but long-term, if you have recurrent ptosis, what we call recurrent breast sag, you want something that can actually hold up your own breast tissue. This is really critical if you have larger breasts, a larger breast implant, more of a lift. And so this is where I think that the internal bra comes into play, because we are definitely seeing longer lasting results that last for years. There are some potential concerns and complications about using an internal bra. One thing is that it can drive up the cost of your surgery, because someone has to pay for the actual internal bra material to the company. So this is one consideration that you may have. Another consideration in terms of medical complications is that sometimes you can feel the actual internal bra. This is especially true if you have a larger breast implant, larger breast volume, or very thin skin, or not much breast tissue, where as it's absorbing, you can still feel the actual material while you're healing up within the first year or two after your procedure. To me, this is actually not so bad. You know that you have material that is slowly being absorbed over time, and we're going to ensure that you're going to have the best long-lasting results. However, it can happen, and it can be a concern in some patients. So some patients have asked me whether I can show results. Now, this is YouTube. I would direct you to my website or to my social media channels, because I have definitely tried to show before and after results on YouTube. Some of my videos have been banned. Some of my videos are downgraded where very few people can see them in the algorithm, which is why I'm a little hesitant to show you before and after results. But yes, I can definitely show them to you, where you not only have a good result, but you can actually see the longevity of such a result. Finally, what's your next step? I think the thing is, definitely educate yourself, get to know what procedures are best for you, and talk to your own plastic surgeon about whether you feel that you need an internal bra, or whether your plastic surgeon feels that you would need an internal bra to give you the best long-lasting, beautiful aesthetic results. Thanks so much for watching. Definitely watch my other videos here on this channel.